Well, we're going to talk about the dimensions of wellness and primarily what kind of components are going to be what we're going to talk about this semester. And you are made of many, many components, and part of this is your physical self, your mental, emotional, spiritual, and social self. What we often see is wellness shown as a number of components or dimensions. So you have a physical body, and your physical body consists of your muscles, your bones, your blood, your brain, your gut. That is primarily your physical self, and many times that's what we focus on. But we also know that our physical wellness is just part of who we are. We also have our search for knowledge, which is our intellectual wellness, our emotional wellness, which is how we feel about ourselves and others, our social wellness, how we interact with others and having good relationships, enjoying life, um, occupational wellness is knowing that you're finding something that is fulfilling, and no matter what you do in terms of your role, your job, whether it be in school or in the workplace, that it feels like you're filling a need. Environmental wellness is living in an environment that is healthy. It can be structure, it can be the outdoors, it can be air quality. It's the whole thing. So when we look at our components of wellness, we know that all of these parts become intertwined and also help us to be moving forward in a better and better place in life. I forgot to mention spiritual wellness, and that means that you're finding purpose and meaning in life. One of the things that we do in this course is work on a plan of improvement, and it's called a behavior change plan. Another component is to learn about some sustainability. Those are the two big components or outcomes of the course. So I'd like to focus a little bit about those wellness wheel areas that are potential opportunities for you to focus on for a project for this semester. So we're going to look at some common issues that college students report as concerns for their well-being. And how I'm going to utilize this is to show you some information that is from the CDC, and it is called Healthy People 2030. Healthy People 2030 is something that has been updated every decade, and I believe it started in 1980. So it's been around for a while. So it's a matter of determining what steps are being taken and what goals can be set to help people to live their best life. And these components are broken down into, have changed over the years. There are goals that are set for a 10-year time span, and it could be related to disease, it could be related to health behaviors, related to an age group, or even perhaps a workplace and safety in the workplace. So let's take a look at a couple things that I've found that students really like to focus on and see what kind of guidelines that we have and what kind of goals are available and how we're doing. The first one is sleep. And one of the many areas that gets excluded from a lot of textbooks, and it's getting better, is sleep. And what we do know that getting sufficient sleep is associated with your emotional, your intellectual, your occupational. It influences. If you don't get enough sleep, you have difficulty excelling in all other areas of your life. And based upon the last data point, it appears that we're not meeting the goals. So here, each one of these slides will have a target value. And the target value is of the adults aged 18 and over that get sufficient sleep, can we get to 73.3? And the baseline that was in 2020 was 72.3% of adults. And how this data is collected is in, hello Paris, a variety of ways. And what we know that it has lessened, it has gotten worse. And so the bar is red. It means that since the last time this data has been um, collected, we're actually getting less sleep, then we're moving farther away from our target. And our goal is to increase. So many times students like to work on their sleep and to get better sleep during the semester. Another area that is often focused on is nutritional areas. And this is in the physical. So far, sleep is in the physical dimension, and so is your nutritional choices. And one of the areas that we could do better in as a whole is eating enough vegetables. And since the last data collected in 2017, it appears that we're really not doing any better. The target is to get about 0.84, almost a cup of vegetables for every 1,000 calories. And what we have occurring is actually a decline in how we're doing with getting enough vegetables. So that is something that individuals sometimes want to improve upon. Another nutritional component is fruit. And since the 2017-2020 data, it appears that there has been very little change. We're not getting to our target of about half a cup per 1,000 calories. And our goal is to increase. Right now, we haven't seen really any change over the past 4 or 5 years. Another section is if we look at the emotional wellness, could be individuals that are seeking treatment for depression or other mental health components. Now, there are a number of mental health um, descriptors, and I just identify depression. What was interesting to me is that there's not one on anxiety, which tends to be pretty prevalent in college students. We know that we're really not doing much better from the last time that the data was collected between 2018. The baseline is 68.8% of adults that get treatment and diagnosis and treatment, and we really would like more individuals to have that. About half the people in the United States will get diagnosed with a mental disorder at some point. And so getting prevention, treatment, assessment of behaviors that are associated to that will be influencing our emotional and all of our dimensions of wellness. Another area is using prescription drugs, misusing prescription drugs. There's been very little change in that since data was collected in 2018, and we have 6.2% of individuals over the age of 12 misusing prescription drugs. This could be any kind of prescription drug, whether it's borrowing somebody's Adderall, or or even if I shared my prescription for anti-inflammatory. That would actually be a misuse, right? So not using by label a medication and not sharing medications. We want to improve that where we use medications appropriately and as should be taken, as they're prescribed. Here's another one, binge drinking. Reduce the proportion of individuals over 21 who have engaged in binge drinking in the past month. That has not really improved. The most recent data is 26%, and the baseline in 2018 was 26.6%. And so we're looking at decreasing the number of individuals that binge drink in the past month. And so this is again, another area where individuals sometimes want to monitor and this is a safety issue, make sure that they're not over consuming or that they're not taking beverages from someone that they don't know, but that's another area that somebody might want to improve on. And of course, I always want to add what we're doing to be physically active. Now, there are a number of targets, individual targets, and I'm just selecting one that has both aerobic or cardio and muscle strengthening activity together. So whether or not we look at individuals, if they're doing sufficient level of cardio or muscle strengthening exercise, we're not doing enough. What we need is a mix of 150 minutes per week of moderate intensity aerobic activity and at least 2 days a week of muscle strengthening activity. Now, these are goals that have been set forward for us for maintaining general physical health. But if we look at who's getting enough, we're not reaching the goal. Whether we separate them or we put the two types of exercise together, whether we look at getting baseline or getting enough activity to exceed or for big improvements in fitness, being we're not meeting that goal either. So as we look at what we have, maybe a quarter of the adults are getting enough aerobic cardio and muscle strengthening exercise. And our goal is to increase that. And what I want to make sure that you're seeing is that these are just small, creepy numbers. It's not going from 25% to 50%. We're making small steps, small improvements, small changes, and those are our idea, our success, what will help us to build success. Now, being able to get enough aerobic or muscle strengthening activity is going to include uh, choices, behaviors, whether or not you have access to a place to exercise, whether or not it's encouraged by where you live, work, and play. Those are factors that influence our ability to get enough physical activity. We have to make sure that we also address that wellness is just not a simple recipe. There are many components that influence and affect our wellness, and one is our choices. What kind of choices, how we live our life, and how you live your life is really based upon what's important to you, and you make choices that will bring you what you desire. The environment where you live, whether or not you live in a safe environment, if you have clean air, clean water, that impacts your wellness. Whether or not you have a safe place to walk, to jog, all of those components. Your genetic makeup, if you have a family history of a chronic disease such as arthritis, cancer, respiratory disease, asthma, etc., there are it's not a guarantee that you are going to go down that same path, but it's important to know if you have risks, so then you can make lifestyle choices that can decrease your potential risk. We know that how you view life, your emotional state, having good mental health is really important. We know that people who are energetic, that have good moods and good physical health, are more likely to have less pain, decreased symptoms. And so that's going to influence your your wellness. And finally, it's important to recognize that healthcare, whether or not you have access to it, is important for wellness. We're not going to look at this as something that blame. This is not a blame game. In many cases, it's whether or not something is important to you, whether or not you have access, the skills, knowledge, ability, and the support system to be able to do things that are going to drive you or bring you to your optimal level of wellness. So, improving wellness, some of it is going to be related to the topics that we're going to cover. Being physically active and moving more, maybe walking a little bit more, maybe exercising, maybe taking a class, choosing, thinking about the choices that we make when we, uh, with what we have in our diet, getting enough sleep. There will be some opportunity this is my dog. Hello, this is Francois. Francois is very wiggly here. Every module you'll have an opportunity to do a relaxation or meditation activity where the breathing exercise. In response to that, we're going to look a little bit about how we use substances, including alcohol, tobacco, drug use, avoiding risky behaviors, and really being thinking about how to make better choices and good choices and feel good about them. Part of what is also important is making sure that we've got good support system around us, having good relationships, that individuals are there for us when we when we need to have someone to talk to. Planning on aging well. You don't realize it, but aging is occurring to us all as we're moving along. Learning about our screenings and also act responsibly to the environment. So finally, what we're going to do is we're going to work on behavior this semester. We're going to set some goals and we're going to make a plan. And then you're going to track your plan and make adjustments as necessary. And that will be coming up in the next module. All right. Cheers. Have a good rest of the day.